Welcome to Caring for People with Dementia, a primary care partnership. Let's get started. We created 5 microlearning lessons for primary care providers on person-centered approaches to people living with dementia and their care partners. The 5 topics were on demystifying dementia, sharing the diagnosis, providing guidance, communicating, and more than meds. These lessons are innovative in that they are both in a microlearning format and they are person-centered, meaning that the content is uniquely from the perspectives of people living with dementia and their care partners, while being grounded in evidence and translatable to everyday practice. Primary care providers have said that these microlearning lessons increase their confidence around people with dementia, their thoughts that they can make a difference in the lives of people with dementia, and their belief that they had ample training related to dementia. In addition, 96% agreed or strongly agreed that microlearning is a helpful way to learn, and the training helped them to have a better appreciation for the perspectives of people with dementia. The features primary care providers most liked about the microlearning format were the small short lessons, learning at their own pace and speed, accessing the training whenever they needed, the video clips, getting training on a weekly basis, and using what they learned to care for people with dementia, confirming a key benefit of microlearning, to apply new knowledge and skills quickly into person-centered practice. Given the demands on primary care providers, it makes sense that microlearning is a good fit. In the spirit of patient and person-centered care, these lessons are grounded in the perspectives of patients and their care partners. To kick off the series, patients and care partners now remind us of some foundational approaches to care that they have identified through their primary care partnerships.
Knowing your patient well, if they know their profession before the disease and what do they love to do during those days, knowing their family dynamics, the financial capabilities of the family, treat them as a whole person. Humans have 4 dimensions. We have mind, heart, body, and soul. So don't compartmentalize the patient. Use the holistic approach always. And also treat their family members as good as well, because this is an emotional, mental, and physical illness for everybody.
And we continue to make appointments with him to take her back periodically, I guess every 3 to 6 months, for him to check on her and make sure that we kept up with her health. And that was very important. Not only just her health, but to make sure we kept up with all her medical, such as dental, hearing, her feet, everything, still continue to treat her because she's a patient, and she's not an outcast or anything. She's still a human being. She's still a patient.
If I would have had another doctor that didn't have the charisma and the love he shows to my mom, I would tell you more love and more caring, because that's what makes her glow. All that love and all that caring. And if every doctor could give all that love and all that caring for their patients, any kind of patient with any kind of illness, it makes a big difference. It makes a big difference,
And even, after my aunt passed, and I was really surprised at this. It was a pleasant surprise. She called me. My primary care physician called me. She found out that my aunt had passed, and she called me, and just to acknowledge and I thanked her for just helping us to care for her. So it's just like anything else. You build relationship, and you can tell that. You walk into an office and with somebody that that's familiar and you can tell that you're building a relationship over time. So it's important.
Thank you for all you do to treat the whole person, provide loving care, and build relationships with your patients with dementia and their care partners.